So Brandon Zimmerman is our next speaker, an expert on dissection photography. He joins us from the Legacy Center, Archives and Special Collections, Drexel University College of Medicine, a place I had a privilege of visiting just before the pandemic. The title of Brandon's paper is The Role of Maude Abbott in the Curation and Expansion of the WMCP, the Women's Medical College of Pennsylvania Pathology Museum. Brandon, over to you.
Truly an honor to be here today. My thanks to the organizers, Professor Adams in particular. Thank you for the invite way back in the before times. This has just been such an amazing day. I have a ton of stuff to cover here, so I'm going to get right into things. This presentation really is something that was born from several great passions of mine: dissection photographs, the material and visual culture of anatomy and dissecting rooms, and extinct medical museums. As we're going to briefly discuss here today, Maude Abbott was foundational to the development and organization, curation, and expansion of the Pathology Museum of Women's Med, the first degree-granting medical school for women. My talk here today is going to include a brief overview of the state of anatomical and pathological collections at Women's Med prior to Abbott's tenure to set the stage for her arrival. Then we'll delve a little more in depth into the specific time period that Abbott was associated with Women's Med, its various museums, her contributions, etc. And then if there is some time left over, I'd like to conclude with a super brief survey of what is in fact left of those collections at the Drexel University College of Medicine, which is the official repository for the records of Women's Med. So to begin, from 1923 to 1925, Maude Abbott served as the chair of pathology and bacteriology and the director of clinical laboratories at Women's Med. In addition to those duties, she expanded training for female medical students in the fields of surgery and surgical pathology, and was foundational to the development of the WMCP Pathology Museum. But to go back a few decades prior to her arrival in 1923, for countless years, collections building practices at Women's Med, the Pathology Museum, their Anatomy Museum, mirrored the limited gender-specific roles assigned to women physicians. Primary emphasis was placed upon illustrative materials, gross anatomical and pathological specimens in the fields of obstetrics and gynecology. Now, given the restraints placed upon women at the time, their limited access to clinical work, and the narrow focus of their private practices, this, of course, begs the question, what kind of anatomical and pathological material would women physicians and students actually be able to obtain or even have access to? Women's Med and its associated museums were in a unique position, detrimentally so, in that the normal avenues of specimen acquisition were intensely hindered by gender. And I can't think offhand of any other medical museums, at least here in Philadelphia, even those that were on the fringes of medicine at the time, such as homeopathy, etc., that really labored under similar restrictions. Now, leading up to and during Abbott's tenure, museum specimens were procured from limited sources. Anatomically speaking, most specimens came from, and therefore most anatomical preparations were made from, state-assigned cadavers. The Pennsylvania Anatomy Act of 1883 provided medical schools like Women's Med with the bodies of the unclaimed dead from prisons, asylums, state hospitals, etc. That Women's Med accepted or was allowed to accept male cadavers that might be, sort of a given, but is in fact a new discovery to us. Given the biases and the issues of the times, we really didn't know with any certainty that Women's Med could receive the bodies of both sexes. Now, to divert attention momentarily to why this is so significant, again, it is because of industry bias. Male doctors, including very prominent physicians of the time, did not believe that female doctors and students should be allowed to dissect. They believed it was unwomanly, that it annihilated social distinctions and turned them into, quote, sexless monsters. Taking this fear to an extreme, an example I always like to give is the Pennsylvania Academy of Fine Art and the incidents associated with the firing of famed portraitist Thomas Eakins involved administrators actually cutting off the genitals of cadavers, lest Victorian women who were studying anatomy and dissection there see, penises and be exposed to something that they considered lewd and morally corruptive. So with these biases in mind in terms of specimen acquisition, it is quite fascinating when you consider that women's med received the bodies of dead men and thus dissected, autopsied, and acquired anatomical and pathological specimens from men, especially since students, professional physicians at women's med would have had little to no direct interaction with male patients, either via household visits or in a clinical setting. Male patients wanted to see male doctors only. So with a huge limitation in terms of accessing the city's entire population, the Women's Med Museum was in essence a reflection of the biases and the cultural views of the times. And now, even though we now know male bodies were in fact used to form the museum, it was still in terms of knowledge production and utility, ultimately a museum of specimens that were made sort of for women, by women, and of women, which ultimately calls into question the relevance of such a collection, especially once the college went co-ed in the 1970s. Now, the Women's Med Dissecting Room, again, was the primary source for specimens, but given their relatively small size, matriculation-wise, the college sometimes only received 10 to 15 bodies per year. So where are your pathological specimens coming from? Well, pathological specimens came from dissecting room cadavers, obviously, but the bulk, however, were usually donated or put on loan to the Women's Med through its staff. Now, these would have come through private practice, or if the physicians were associated with a separate, keyword separate, hospital, as was the case with Dr. John B. Roberts, who was a pathologist at the nearby German hospital. Roberts frequently gave brains to the students to study. Access to pathological material through the next door hospital or local professional societies, such as the Obstetrical Society of Philadelphia, which is the oldest such society still in existence, was pretty much non-existent at the time, the latter organization being a result of the fact that women simply were not allowed to join. Likewise, although women were eventually allowed to intern at Philadelphia General Hospital, otherwise known as Old Blockley, famous physicians like Sir William Osler worked and taught there and had the ability to put together small pathological collections from notable cases. Similar avenues were not open to the students or staff of Women's Med, although Maude Abbott did have access, which we'll talk about a little bit later. Likewise, didactic materials such as wax models, papier-mâché models, charts, etc., could and were purchased from overseas, London, France, but these avenues of acquisition rarely included human remains outside of bones. And sadly, although I have turned the world upside down looking for any kind of museum catalogs, prior to Maude Abbott's time, during and after. Sadly, there are no museum catalogs that are extant. So with regards to Maude Abbott, to Abbott, her staff, and her successors, the medical museum was an essential component of medical education and equally essential to the future of pathology. As such, during her time in Philadelphia, Abbott used her unique position, having started the first full-time department of pathology at Women's Med, so her unique position and considerable influence to increase the collaborative potential of the college's pathological laboratories and those of the Women's Hospital next door. Now, this in turn led to an era of prosperity for the Women's Med Pathology Department and its museums through a marked increase in specimen curation, identification, and acquisition. By 1930, thanks to Abbott's work and her successor, Helen Ingleby, a once modest and jumbled assemblage, once referred to, you can see here referred to as curios and kind of organized as a kind of standard cabinet of curiosities. So once referred to as curios of pathological material, had now grown into an enviable and modernized museum. This space was multifunctional, used by teachers and clinicians whenever they wished to illustrate lectures with physical specimens. And as Ingleby herself stated, quote, by thus interesting the clinicians in the museum and the students of pathology in its clinical application, we make an effort to foster the art of accurate diagnosis. Now, in addition to being the chair of pathology and bacteriology at WMCP, Abbott also assumed a host of duties as the director of clinical labs. This later role necessitated by the mass resignation by staff earlier that year resulting from the infamous talent affair, which Dr. Peitzman mentioned this morning. So these resignations afforded Abbott a unique synergistic opportunity. The clinical labs she supervised were not just those located at the college, but also included the facilities next door at the Women's Hospital. Her specific task involved reorganizing and refitting the hospital labs, quote, with a view to make it an integral part of the college system, a teaching laboratory connected with a teaching institution. In this endeavor, she was assisted by Assistant Director Elizabeth Dixon Wilson and technician Jean Coffin. And together, the trio sought to make possible, quote, a correlation of the work of the hospital and its laboratory with that of the laboratories of pathology, bacteriology, and clinical pathology in the college. Now, unfortunately, we have no data to determine exactly how successful this endeavor was in terms of the museum. For example, if Abbott desired to form a similar collection to that of McGill, focused on congenital cardiology, disease, et cetera, there's no record here in Philadelphia, to my knowledge, that states so. However, while we have no real metrics to gauge how useful the hospital was in terms of enhancing the pathology museum, there was definitely great potential there. For example, clinicians at the hospital like Catherine McFarland, who also served as professor of gynecology, reported over 40 cases of cancer-related illnesses alone between 1919 and 1922, right before Abbott arrived. Many of these required the removal of growths, tumors, full hysterectomies, etc. And prior to Abbott, the majority of that material was disposed of. And once Abbott arrived, she created an umbilicus. I don't mean that too punny. She created an umbilicus between the clinics and the classroom, and specimens collected from living and deceased patients could finally be collected and preserved next door in the Pathology Museum alongside corresponding data. Now, likewise, Abbott extended her reach beyond the walls of Women's Med and secured access to the same cache of autopsy materials as mentor and friend William Osler did 35 years earlier. And this is at Pennsylvania General Hospital. In fact, an interesting anecdote, while driving there one day to obtain autopsy specimens, she lost control of her, quote, secondhand Ford and actually hit a child. Turns out she had no driver's license and there was a threat of incarceration, but the Women's Med administrators intervened and she was left off with only a minor fine. The child only received a few bruises, so it all worked out. Coincidentally, one of the questions asked this morning was whether Abbott actually performed autopsies at PGH. I do not believe she did. I don't think she had that level of access. I think she was merely going there to obtain material and bring it back to Women's Med. Likewise, I'm not entirely sure that she performed autopsies at the Women's Hospital next door to Women's Med, the college. But we do know that autopsies were performed there. So those were two avenues of specimen acquisition. Now, back at the Women's Hospital, staff benefited from Abbott's expertise during regularly monthly meetings, which were customarily held in the hospital amphitheater. At the conclusion of regular new business matters, meetings often turned to discussions or presentations on notable scientific cases. For example, at a meeting on October 15th, 1923 that Abbott attended, she contributed to a small group discussion on a report of an autopsy of an infant given by a Dr. Rishi of the hospital's obstetrical department. And while we have no granular details of the discussion, none were recorded in the minutes, at the conclusion, Abbott did suggest that there needed to be a stronger, quote, correlation of clinical data and pathology. And that really is sort of a running theme with Abbott's time at Women's Med with regards to getting the pathology department in shape. It wasn't just a matter of having access to this material, you needed to have the gross specimen and its appropriate data united. Now, Abbott's introduction of the McGill technique affected lasting change that again provided much needed order to a chaotic assemblage of specimens that over the years were routinely curated and maintained by students, not professional staff. So her presence, expertise, and unifying mandate facilitated a period of collecting that previously hadn't really coalesced into anything substantive or structured. What was previously haphazard accessioning could now be systematic, not only in quantity, but quality. And here we can see rows of specimens in the new museum, each topped with an informational card with all or some associated clinical data, presumably organized according to organ, disease, body system, etc. Now, it's important to note that Abbott's contribution was not so much to organize pre-existing material as it was to establish protocols moving forward, protocols that ensured that specimens and their corresponding case histories traveled together in order to form a data-rich collection that could be used to generate knowledge. Routine purges of older, dataless materials were suggested by Abbott and carried out, which, as lovers of medical museums, whenever we hear about mass purges, of course, it hurts. But in this instance, Abbott gets a pass. This was understandable. Order and structure had to be enforced, had to be enacted, especially when you had such limited resources and space as Women's Med did. If I had to basically sum up Abbott's primary contribution to Women's Med, it would be that she did here what she did best. She brought order to chaos and established basic methods of curatorial care that many of us might take for granted today or consider really as baseline protocols of collections management. Now, that being said, I won't go so far as to say that Abbott's presence solved all of the issues associated with limited resources or sources of acquisition. However, her reputation did afford her the opportunity to upgrade the physical resources of her departments. She submitted requests for the purchasing of major laboratory equipment, including an autoclave, a micro projecting lantern, presumably for microscopical slides, and student microscopes with electric lighting. Now, while there's nothing groundbreaking about those requests, when the alternative was dark rooms with overhead lights or gas lights, these upgrades, Abbott must have appeared to the students really as a beacon of progressivism. Now, again, that being said, I admittedly have made this venture sound a little more concrete, romantic, and robust than it actually was. Although Abbott had high hopes at the onset for devoting specific attention to the college museum, a lack of funds hobbled this endeavor at the onset of the first year that she was there. In November of 23, a resolution was ratified blocking Abbott's desire to hire an extra technician with a sum for materials expenses in the Department of Pathology, quote, in order that she might use her time for the benefit of the college museum to the best advantage. The she there is a little nebulous in terms of whether she means the technician or herself, but in either case, the resolution was again blocked by the executive committee, who stated that it was simply impossible to add to its budget for the department, which is admittedly a little odd. Why go to the effort and expense of courting Abbott, reorganizing a new chair of pathology, and then not give her the resources she needed right at the onset in order to effect immediate change? It is possible that the board overestimated the associated costs of creating a museum, or in the end did not consider the museum of monumental importance, given all the other issues at play and the other things that she needed to focus on. At any rate, Abbott was unable to devote herself or her others' time initially to the growth of the museum. And although her contributions were significant and long-lasting, one does have to wonder what could have been had she had been given all the requested resources from the get-go. Now, in the remaining time, I would like to discuss the extant collections. I know I don't have a lot of time, but will be super brief, mainly because unfortunately, nothing has survived to today from the Pathology Museum. By the 1960s and 70s, Women's Med, like so many other American medical schools, especially here in Philadelphia, began systematically purging their museums. By the 1980s, most would be extinct. I cite, for example, the Great Medical Museum of Hahnemann Medical College, which at the turn of the 20th century was widely considered to be one of the most comprehensive and largest medical museums associated with an active medical school in the world. And today, less than a handful of specimens are extant. What we have here in these two cases, which are located outside of the Gross lab at Drexel University College of Medicine, this is basically all that's left of the previous museums at Women's Med. Again, Women's Med fell victim to the same purges at some point in the last half of the 20th century, and really only a small assembly of anatomical and gynecological bones models survive. No pathological material are extant, so this is essentially all that's left. Here we have some bones with Women's Med written on it, and some Ziegler models from Europe. And probably the most significant collections that are extant related to Women's Med are these gynecological models, which were made by Tremond of Paris around the turn of the 20th century. The interesting component about the damaged one On the right here is that wax model is actually molded over actual human pelvis. There's an actual human pelvis underneath the wax. Now, all of these were still being used up to about 5 years ago when I arrived at Drexel as an independent researcher. I identified them and requested that they be removed from active circulation to form a heritage collection, which they were. And just to sort of give you a comprehensive view of what is extant, also included in this lot of heritage collections at Drexel, although not associated with Women's Med, are several specimens from the former museum that I previously mentioned, Hahnemann Medical College, and include preparations by famed anatomist Rufus Weaver. These are some Weaver preparations here from the former museum. Some teratological and pathological materials that I discovered in the morgue down at Hahnemann Hospital before it closed a few years ago. And of course, our famous Harriet specimen, which is the world's first dissection of a complete human nervous system, which is also still extant and on display at Drexel. I hope I still have some time to answer some of your questions. If not, please don't hesitate to email me. But again, I thank you so very much to be included in today. It's absolutely wonderful. And a very happy birthday to Dr. Abbott. Thank you very much.